JVN, myself JVN Dr. Ravi Jain, Associate Professor and HOD, Department of Practice of Medicine in Faculty of Homeopathic Science at Jyoti Vidyapeeth Women's University, Jaipur. In this series of lectures, we have been discussing about various diseases related to the locomotor system. In today's lecture, we are going to discuss about another important disease condition, that is reactive arthritis. In the past lectures, we have discussed about osteoarthritis, we have discussed about rheumatoid arthritis, different types of different deformities of rheumatoid arthritis, the clinical features, the investigations and management. We have also discussed about psoriatic arthritis. Today we are going to discuss about reactive arthritis. Reactive arthritis is a very important disease condition and many times it is misdiagnosed. Why misdiagnosed? Because it is present after the infection of either GIT tract or urogenital tract, infection elsewhere in the body that is responsible for development of arthritis. So, infection elsewhere in the body. Now, let us see what is reactive arthritis. Now, this is reactive arthritis. Reactive arthritis, why this is known as reactive arthritis? Reactive arthritis because there is presence. Arthritis is pertaining to, itis is inflammation of the joints. There is inflammation of the joints. This is represented by RE, reactive arthritis. This we have to remember in short form. There is bodies. There is macrophages in the joints that we can see is known as reactive arthritis. Now, reactive arthritis, this is, as we have discussed, reactive arthritis, this is due to infection elsewhere in the body that is responsible for non-purulent arthritis. Alright. So, any other infection in the body, most commonly it is affecting either GIT tract or urogenital tract. GIT or urogenital tract, this leads to the development of reactive arthritis. Now, what happens in case of reactive arthritis is, it is also having symptoms on whole of the body. But mainly, we can see what is affected. There is eye inflammation. Now, infection or the inflammation especially of the GIT tract or the urogenital tract. This is caused mainly by the ingestion of certain infectious substances or by the sexually transmitted disease. Therefore, it is affecting either GIT tract or the urogenital tract. Alright, so it is mainly affecting the eyes. Eyes are affected. Diarrhea because of the involvement of the GI tract. Urogenital tract is affected, therefore in males it is producing prostatitis and urethritis, and in females it is producing salpingitis or cervicitis. There is swelling in the knees, heel and ball of foot. This is a very important thing because it is producing sausage digits. What are sausage digits? We can see here. This is swollen finger. These swollen fingers are seen in case of reactive arthritis. This is known as sausage digits or dactylitis. This we have to remember. Alright. Now, what is reactive arthritis? Reactive arthritis is basically I have just now told you, a non-purulent arthritis that is seen. That is due to the arthritis that is complicating infection elsewhere in the body. I have told you the infections. What are the infections? Most commonly, infection of the GI tract or the urogenital tract. The infective organism, the infections from the GIT or the urogenital tract, this is traveling to the joints, and in the joints, this is producing pain and inflammation. Now, what is happening in this particular disease condition? This belongs to the group of sacroaxial spondyloarthritis. This disease is similar to that of ankylosing spondylitis that we have discussed earlier. Ankylosing spondylitis was also related to the axial skeleton and it was associated with HLA-B27. In the similar way, this reactive arthritis is also related to HLA-B27 and this is axial spondyloarthritis. That means it is affecting the central or the axial skeleton of the body. Now, the first symptom that occurs in this particular disease condition is the stiffness. Stiffness of the back. Stiffness of the back. The patient is not able to bend down properly. The back becomes stiff. The vertebral space becomes narrow, and because of which the Schobar test is positive. The Schobar test will be positive. The patient will not be able to bend properly. There will be formation of the enthesitis. Enthesitis means inflammation of the enthesis. This will be seen. Let us see from the PPT what is happening in this particular disease condition. Alright, let us try to understand. Non-purulent arthritis, that is complicating an infection elsewhere in the body. Primary, enteric and urogenital. This I have already told you. Enteric, that is related to the intestinal infection, and urogenital infection, and with the episodes of diarrhea and urethritis. This I have told you. From this picture, we have seen the diarrhea because of the GI inflammation, swelling, sausage digits we have seen, lower back pain. This is the first symptom that comes, and eye inflammation is also present. Alright, during the world, this reactive arthritis, as I have just now told you, this is also occurring from the sexually transmitted disease. So a lot of soldiers during World War I were found affected by this particular disease condition, and they did not come directly with the reactive arthritis, but they came with the triad of three features. They came with the conjunctivitis, they come with the urethritis and arthritis. Triad of arthritis, urethritis and conjunctivitis. Let us again remember this thing. Reactive arthritis constitutes of a triad of conjunctivitis, arthritis and urethritis. These were the features with which the patients were coming in during the World War I. The soldiers who were coming, and they were actually suffering from reactive arthritis, but they were misdiagnosed. Now, the clinical manifestation, they are affected mainly by the enteric infection and congenital infection, genital infections, and these are the bacteria that usually affect. They are affected by Yersinia, Klebsiella, Shigella, Mycoplasma, Chlamydia and Salmonella. These are the common infections. This is mainly affecting the young age group. 18 to 40 years of age are affected, as we have seen in case of ankylosing spondylitis. In ankylosing spondylitis also, the young age group of people were affected. I have already told you HLA-B27 association is marked in both, in case of ankylosing spondylitis also and in case of reactive arthritis also. Alright. Now, these are the various symptoms. We can see in the eyes there is conjunctivitis, urethritis and arthritis. So, lower back pain, sacroiliac joint and buttocks, swollen knees, scaly patches, ankle swollen and sausage digits. I have already told you, shown you the sausage digits. This disease is also affecting the mucocutaneous junctions. Alright. So, joints of the lower extremities are specially affected, and we can see this change. You can observe that one is the normal knee joint and another one is the affected knee joint. This is dactylitis, the swollen finger, that is known as dactylitis or the sausage digits, and there is also inflammation of the Achilles tendon. This is common, and the disease is so severe that sometimes the patient even has to change his job because of this disease condition. The joints are usually very much painful and tension with the joint effusion. The joints become painful. Initially there is infection of the gastrointestinal tract and the genitourinary tract. This infection is moving to the other parts of the body. They are producing either conjunctivitis, urethritis and arthritis. In the joints, because joints are affected, therefore we are studying this particular disease condition with locomotor system. So the joints become tense. There is dactylitis and sausage digit. I have already shown you the sausage digits, and there is pain and inflammation at the site of insertion, that I have already told you, enthesitis. Alright. this enthesitis. This is the most important feature that we have to remember in case of reactive arthritis. All right. Now, what are the symptoms? I have already told you, low back pain and buttock pain is very much common. There is inflammation at the site of insertion, sacroiliitis, arthritis, urogenital. I have already told you that it is causing in the males. This is producing urethritis and also prostatitis. In the female, I have told you that it is producing cervicitis and salpingitis. These things are produced. This is the condition of conjunctivitis, how you can diagnose. Now, ocular disease, there is conjunctivitis that is seen. Apart from this, I have also told you that there are various mucocutaneous lesions that we can see in case of Retter's disease. This is the mucocutaneous lesion of the mucous membrane. These are the cutaneous lesion of the skin on the tongue and on the nails. These are the changes that we see in case of reactive arthritis. The changes we have to elicit by the pictures. Now, mucocutaneous lesions, there is painless lesion on the glans penis. All right. Next, we have nail changes, onycholysis. You can see this. This is the onycholysis. All right. Onycholysis, this can be seen. Uncommon manifestations in the heart, we have pleurocarditis, cardiac conduction, and so on. All right. Arthritis, this tendo-Achilles we have seen, and this is the calcaneal spur. This is the bony overgrowth that happens in case of reactive arthritis, and that is producing work disability and forced change of occupation. That I have just now told you that because of this disease condition, many times a person has to change the occupation also. Now, what are the lab findings? Because this is an inflammatory disease condition, another important thing that we need to understand is the how to investigate the case. Now, because this is an inflammatory condition, therefore ESR will be present, ESR will be raised. All right. Apart from this, there will be HLA B27 association of this disease condition is present. X-ray findings are positive. Now, let us again see what are the things. Now, rheumatoid factor and ANA, this we have to remember. Rheumatoid factor, this was present in rheumatoid arthritis, and anti-nuclear antibody we will be seen in case of other disease condition that are related to the autoimmune disease. Mild anemia is there, leukocytosis and elevated ESR. This I have already told you that because this is an inflammatory disease condition, so ESR will be elevated. HLA-B27 association, this we have to remember. HLA-B27, always remember. HLA-B27, this is related with ankylosing spondylitis and also reactive arthritis. Alright, PCR polymerase chain reaction can be done. Synovial fluid aspirate, this is important thing. Alright, Retter's cell. Reactive arthritis contains in the synovial fluid of the joint giant macrophages that are known as the Retter's cell. This is the diagnostic feature. Another thing, syndesmophytes. This syndesmophytes we have also seen in case of ankylosing spondylitis when the vertebra, the two vertebral columns were joined. Let me again show you the syndesmophyte. Look, these are the syndesmophyte, the bony fusions that we have seen in case of ankylosing spondylitis. This bamboo spine or this calcification of between the two vertebra that is leading to the formation of syndesmophytes. It is also seen in case of ankylosing spondylitis and also in case of reactive arthritis. Now, what are the differential diagnosis? What are the various disease conditions that resemble the reactive arthritis? We have gonococcus arthritis, crystalline and psoriatic arthritis. Now, the management part. Since this is a painful condition, all right. So, NSAIDs to relieve the pain and inflammation. NSAIDs can be given. Indomethacin can be given for antibiotic treatment for the different type of infections. We have seen different type of infections like Yersinia, we have seen Klebsiella, Shigella, Salmonella, Chlamydia and Mycoplasma. There are different type of infections. Therefore, for the treatment of those infections, we need antibiotic treatment. tendinitis and other enthesitis lesions by glucocorticoids. So NSAIDs are important, glucocorticoids are important, antibiotic therapy is important, skin lesion with topical treatment can be given, and for the conjunctivitis, uveitis with ocular systemic glucocorticoids, and sulfasalazine may also be given to the patient. So let us revise this particular disease condition. Let us revise this particular disease condition. Reactive arthritis. This is caused by the infection elsewhere in the body that is prominently affecting the axial skeleton. Alright. So there is pain and stiffness. It is characterized by triad of three things. There is conjunctivitis, there is urethritis and arthritis. Alright. Three things are present. HLA-B27 association is there, enthesitis is also there, alright, and ESR is also raised. So this is about reactive arthritis. Reactive arthritis, I hope you must have understood the reactive arthritis properly. We have the skin manifestations, we have eyes manifestation, we have mucocutaneous manifestation, we have joint manifestations. So all these things we have discussed today. We have also discussed about how to diagnose the disease condition and its management. Apart from this, various homeopathic medicines can be given. Homeopathic medicine can be given on the basis of symptom similarity. Commonly indicated medicines are aconite, Bryonia, Hipersulf, Restox, Rhododendron and sulfur. These are the common medicines that can be given on the basis of symptom similarity, and they offer very good result. Apart from this, because this is a psychotic disease, we can also give Medorinum, Thuja, Cantharis and Staphysagrina. For the urethritis, for the conjunctivitis, we can give Euphrasia. So these are the common homeopathic medicines that can be indicated in such cases. I hope you must have understood the session properly. So this was all for today. We will be meeting in the next lecture with a new topic.